Hi everyone, I'm Ed Highland. This is the Big Ideas Theater, sponsored by Mylan. I'm joined now by Lanny in Abinit. Lanny is from Boise State University, and we're here to talk a little bit about the effects of comorbid conditions on COPD outcomes. First, Lanny, if you would, just kind of the big picture.
Great. So I am a research doctoral student, and my dissertation is on comorbid conditions and their effect on COPD outcomes. I look at it from a cost and a clinical perspective, so a topic very near and dear to my heart.
Now, what are the some of the common conditions that you see in
Perfect.
outcomes?
So we use, in my research, we use what's called the Elixhauser Comorbidity Index. Those are 31 comorbid conditions that are identified. So common ones: congestive heart failure, diabetes, electrolyte disorders, those types of things are really the common comorbid conditions we see with COPD.
Now, how does that affect patient outcome?
Perfect. So it's unique in the fact that we sometimes assume that patients just have COPD, and especially when they come in with an exacerbation of COPD. So we don't really understand kind of the background, I say, for the patients. So what really happens is they come in and these other conditions are still manifesting themselves. And what I try to study is how do those extra conditions affect not only their length of stay, but their overall cost in that stay, but their overall cost of disease. And it's very unique because we see lots of patients, and sometimes you'll see patients with 13 or 14 comorbid conditions. We're not highlighting them because they're not in for that condition, they're in for their COPD, but it's unique that it's probably manifesting their COPD for sure.
Does this make the clinician something of they have to be an investigator? They
For
have
sure.
to really dig deep to find out what's going on with this
For
person.
sure. So we try to teach, and it's for my job at Boise State, I teach a disease management class, and in that I teach about the complexity of disease. So I always say disease is never singular; it's usually plural. So we have to really help the therapist understand to dig a little deeper, to look at that history and physical, and try to find those comorbid conditions. The other thing that I love is to have those conversations with patients. So you have COPD and this, and I like to ask them, how does one affect the other? So during a normal day for a patient, how does your diabetes affect your breathing and vice versa? So I think it's really driving those conversations with patients to say, do you understand your comorbid conditions and how they play a role in your COPD? And then how does your COPD affect your other comorbid conditions?
Well, then you have patients who are unable to communicate. They may be
sure.
too young, or they
For
may
sure.
have other issues.
For sure, and I think what we try to see, and I always feel like that sometimes we're very focused on just the COPD, and the unique factor is that we know medications that are used for COPD also affect diabetes, cause osteoporosis, cause muscle weakness. So what we try to look for, and what I try to look for in my research is can we provide a link? So can we have those conversations with patients that get them thinking the next time they talk to their pulmonologist or their endocrinologist? How can we help each disease treat it individually but holistically as well?
Tell us a little bit about perhaps what some of the modalities would be for non-invasive neonatal.
Perfect. So what we're seeing now, and it's kind of unique, there's been a lot of research here with this. So when we're treating our COPD patients, obviously non-invasive ventilation has shown good outcomes, but also things like high flow nasal cannula, lots of new therapeutic drugs, so combination drugs, so drugs that are for inflammation, drugs for bronchoconstriction. So we're seeing that. The challenge, though, I always say with any therapeutic is how then does it affect another condition. So a good example of that is inhaled corticosteroids can have a negative effect on immunity. They can have a negative effect on glucose. So I always show my patients there's lots of great medicines, but remember you have lots of conditions. So one medication may help your breathing, but does it have a negative effect on another disease? And that's really kind of been my fascination with comorbidities over the last 4 or 5 years that I've done my doctorate, is that how do all these interplay with each other, and when we treat patients, getting away from I'm your lung doctor and this is all I'm focused on, to more of a holistic approach of I'm your lung doctor, I'm treating your COPD, but I'm also recognizing these other conditions.
Now, where are you drawing your information from?
Perfect.
You've got obviously your own practice, but tell us a little bit about where you get your information.
Perfect. So I use large data. So I actually use data from Pharmetrics. So it's a large claims database. So I use claims data, which isn't perfect data, but I use claims data. And what we look at the good thing with claims data is that we can see length of stay, we can look at cost. It's de-identified, so it's safe for use. But also, I'll be honest, I do a lot of impromptu interviewing with patients in my clinical practice, so I still work clinically. And I love to sit and have those conversations with patients. When I go through their history and physical, I find out other things about them, and then I sit down and talk to them about their other conditions. And it's amazing when you have those conversations what you really learn about the complexity. So it's not just that one moment in time where they have illness. It's really their day-to-day life, how these things affect. So it's really, I always say it's really interesting. I think patients appreciate that you care about the long term and not just the short term.
I was going to say, is it one of those things where we need to talk more? I mean, not only to the patients, but perhaps to each other.
For sure.
To share this information.
For sure. I think that, I've always said as a respiratory therapist, we get very focused on the lungs, right? We get very focused on that pulmonary illness. And what I try to teach students is that you have to understand the complexity, and maybe not all the physiology of all these other diseases, but the complexity of the patient. And then when you're developing your plan and when you're having those conversations, those things can be brought up. So you're always talking about how is your day? I always say my approach to managing patients is tell me about a day in the life of you as a patient. So what does Monday look like? What does Monday morning look like and lunchtime? And I think when you sit down and look at that, it's really very interesting. And then it's including the nursing staff. So having those conversations with the nursing staff about medication administration and really sitting down and getting together and saying, we can really make a difference in this patient's life if we're unified, right? So if one of us is sending a message of this way and someone's sending a message this way, we're never really going to get those patients to where they need to be. So it's really collaborative. Something we have done, which is very unique at my facility, we round with the hospitalists. So respiratory therapy being added into that mix. We also have a COPD navigator where I work. So she's in charge of seeing those patients, doing patient education, and then reporting that patient education back to the physicians. So really connecting everyone in the loop so that we're treating those patients individually and we're meeting all their needs.
It sounds like great team building too.
For sure.
Sharing that information about the patients, because ultimately that's the goal, is to make sure the patients are comfortable.
And I think we have to teach those things, right? So in academia, I think we have to get better at teaching students that it's one team. It's never individual. You can't, in your profession, you will never do anything individually. It's always part of a team, and teaching students to work in that team and to understand those things.
Well, Lanny, thank you so much for coming by. Good luck on the doctorate.
Thank you. I appreciate that.
And we will talk to you at some point in the future.
Thank you.
And this is the Big Ideas Theater. I'm Ed Highland. Big Ideas Theater, sponsored by Mylan.